Good afternoon, everyone. To start, Dr. Healthcare Management Consultant with over 16 years experience in the healthcare. Expertise is varied and covers areas including strategic stakeholder management, claims and medical case management, wellness, health insurance, policy and planning. She holds a master's degree from the London School of Economics. Welcome Dr. Anu Martins to the virtual training platform today. We look forward to benefiting from a wealth of knowledge and experience. Over to you, Dr. Anu Martins.
Thank you very much. Good afternoon, ladies and gentlemen. Just a quick request to my host to please.
Again, good afternoon to everybody. A big thank you to the LASHMA team for having me here to facilitate this presentation. It's quite an honor. And then to the LSHS providers, all the representatives that are here, thank you for coming. It's a mixed bag. Medical doctors, consultants, general practitioners, nurses, medical records managers, we're all healthcare professionals. And I believe that the goal that we all have in providing care to the citizens of this state is to make sure that the quality of care is top-notch. So the drive by the LSHS team is to make sure that as much as possible, the framework that we all use is on the same level, the same foundation, which is why the ICD-10 training is extremely important. What we'll do, because it's a virtual event, and to make sure that things are orderly, I will run through the slides. I will explain as best as I can and focus on the important aspects. And we have selected times where we're going to take questions. We'll have question and answer periods. So please note your questions, note them down. And then when it is time to take questions, we will take questions in an orderly fashion. Then your feedback was very good. If for any reason you can't hear me or there are any issues, please just let me know as quietly as you can. Thank you. So the topic for today's session is how to use the ICD-10 system of coding to arrive at a correct diagnosis. I'm Dr. Anu Martins, I've been introduced already. I have quite a bit of experience in the healthcare space. And so by God's grace, I'll be bringing to bear the experience that I have both from the clinical aspect and from the management aspect. The goals for this training are to understand what the ICD-10 is, what its structure and its importance is. You will learn how to correctly code clinical cases using the ICD-10, how to submit correct diagnoses and claims using the ICD-10 on the LSHS ICT platform, which is very important. And then, as I said earlier, the whole purpose, the overall goal, is to contribute to the drive for quality assurance across the scheme. So what is the ICD-10? Maybe just as an icebreaker, if one or two people can type in the chat box and tell us what you think the ICD-10 is. What do you know the ICD-10 to be, or ICD? I'll give you a minute for that. What is the ICD-10? Can anybody tell us? Okay. Musa Odine says ICD-10 is classified diagnosis. Okay, good. Golden Cross says international classification of disease. Yes, thank you. Those are two very good suggestions for what the ICD-10 is and what the ICD is. So you're right, thank you. The ICD-10, basically the ICD, is the International Classification of Diseases. That's what ICD stands for. So it catalogs the known body of diseases, disorders, conditions, or any health-related concern. Everything is categorized under this international classification of diseases. It is completely comprehensive. Any disease that is known to man, including the most recent diseases, are classified under the ICD. So it is the foundation for the identification of health trends and statistics globally. And this is the international standard for reporting diseases and health conditions. So it is a foundation. It's used everywhere in the world. Ideally, it should be used everywhere from a local standpoint, regional standpoints, meaning your hospital, your local governments, Lagos states, nationally, and then our neighboring African countries and beyond. So that is the beauty of having an international classification of diseases. It was endorsed by the World Health Assembly, which is the gathering of member states of the World Health Organization. ICD-10 specifically was endorsed in 1990, and ever since then, there have been several iterations of the ICD-10. Iterations, by iterations, I mean revisions. It is a part of the family of international classifications that the WHO uses. So it also includes the International Classification of Functioning, Disability and Health, ICF, and the International Classification of Health Intervention, ICHI, which is currently being developed by the WHO. So even though there's a family of international classifications, the other ones that I just mentioned they're not as mainstream as the ICD. The ICD is what is expected to be used by every member state of the World Health Organization. And so therefore the focus is on the ICD. So some of the uses of the ICD include monitoring the incidence and prevalence of diseases. We should know what that is. If you have any questions, please note them down. But incidence basically is when diseases occur, and prevalence is how common those diseases are. The ICD also helps us to observe resource allocation trends. So LASHMA, for example, would be analyzing the claims trends that are submitted using the ICD-10 coding to determine how the state finances are being allocated and whether it's been allocated appropriately from a public health standpoint. We'll go into details of that later. Then the drive for this presentation is that it keeps track of safety and quality guidelines. We'll see why that is important later. It's very important for everybody to be on the same page and to use the same type of coding for diagnosis. It helps us to monitor mortality and morbidity rates and also external causes of disease. So some of the benefits of using the ICD classification system include easy storage, retrieval, and analysis of health information for evidence-based decision-making. Many of us should be familiar with the term evidence-based medicine. So everything that is done scientifically, medically in the health sector is all about evidence-based. So whether it's actual clinical medicine, whether it is medical records, or whether it is the submission of claims and the request for reimbursements, health information must be evidence-based. So the ICD classification allows for that. It also allows for sharing and comparing health information between hospitals, regions, settings, and countries. And even from a local perspective, even your own hospital, if you use the ICD-10 coding appropriately, you can compare your data year on year as an example. So it also allows data comparisons in the same location across different time periods, which is what I just said. So who uses the ICD-10? Everybody that is here represented and even more. We have medical doctors, researchers, health information managers and coders, health ICT professionals, managers of medical records, policymakers, insurers, health management organizations, epidemiologists and public health personnel, medical statistics personnel, nurses and hospital administrative staff, and the list goes on. Healthcare professionals, more or less, are the people that use the ICD-10. So let's take a quick look at the history, evolution, and future of the ICD. So I had mentioned earlier that the WHO stipulated the use of the ICD-10, which was the 10th iteration of the ICD. And ever since then, it has been revised and published in a series of editions. Each revision reflects the advances in healthcare and in medical science. So from the laboratory and diagnostic medical perspective, for example, 20 years ago, 30 years ago, there was nothing like a CT scan or an MRI. But as time has advanced, coding has allowed to include such laboratory procedures. And that is just one example. The ICD is used by 117 countries around the world. All these countries are member states of the World Health Organization, the WHO. So in case you didn't get that from the beginning, the ICD-10, that's the International Classification of Diseases, is more or less, the WHO owns the responsibility for implementation, for revision, and for its use by member states. So once you hear the ICD, just know that it's related to the World Health Organization, of which Nigeria is clearly a part of. So in recent times, to show you how it's evolving, the ICD revision process allows for collaborative web-based editing. So what you find is that the ICD-11, which goes into effect in January of 2022, was actually revised online. Nobody sat down in a physical room to review ICD-10, no. It was done online, and then it was peer reviewed to allow for accuracy and relevance. And also what the WHO has said that they hope to do for the ICD-11 is to make the coding a little bit simpler. So that is how it's going to continue to evolve. The ICD-11, another improvement is that it will be available in multiple languages, and it will be compatible with electronic health applications and health information systems. So no more hard copy, no more writing down things, no more printing out. Everything is going to be compatible with the electronic health applications that most hospitals have or should have as soon as they can. It will also be free to download online for personal use. So basically the ICD is here to stay. So if there's anybody on this training who is a little bit reluctant to learn more about the ICD, you may have to change your attitude, because the ICD is only going to evolve as time goes on. But the good thing is that as everybody adopts the use of the ICD, as we carry out trainings like this, as we use it and use it in our own hospitals, it will become easier and easier. And also as it evolves, it will be easier to apply. So let's understand the premise and the structure of the ICD-10. This is very important. And from here, it becomes a little bit technical. So if you've not been paying attention, please pay attention here. The ICD-10 classifies diseases in a clear hierarchical manner. So the first thing is that the ICD-10 has 22 chapters, and those chapters are designated with Roman numerals. So 1, 2, 4, 5, 20, 22. So 20, for example, is XX, 22 is XXII, 4 is IV, and so on and so forth. But you don't really need to know this. You don't need to cram it. You just need to understand it. What the ICD-10 does is that each chapter covers a designated section of disease. So chapter 1, for example, would cover infectious and parasitic diseases. Then another chapter would cover diseases of the respiratory system. Yet another chapter will cover diseases of the cardiovascular system. So the chapters cover broad sections, broad but related sections of diseases, syndromes, and healthcare conditions. So that's how it starts. Then each chapter is then further divided into alphanumeric blocks. Alphanumeric, that is using letters of the alphabet and using numbers. So you have chapter 1, for example, which is for certain infections and parasitic diseases. It contains alphanumeric blocks from A00 to B99. And that A00 to B99 has a hierarchy of diseases, all of which fall under infections and parasitic diseases. So we'll see examples as we go on. but just have the mind's eye that you have one chapter, chapter 1, for example, is broken down into A00 to B99. A00 itself then goes on to have specific diagnoses, as we shall see. So each alphanumeric block is further divided into decimal numbers for specific diagnoses. So you could have A00.0. And by the time you get to the stage where it is alphanumeric with a decimal number, that means it is a specific diagnosis. So I'll give a very basic example here. Chapter 15, XV, covers pregnancy, childbirth, and the puerperium. And it contains O00 to O99. Now, O30 is for multiple gestation. And we all know that multiple gestation is not a diagnosis. Multiple gestation is more or less a description. It doesn't yet tell you what type of multiple gestation it is, because there are different types of multiple gestations. So when you go further under the O30, you will find that there's O30.0. O30.0 is specific to twin pregnancy. O30.1 is specific to triplet pregnancy. So that means if I'm submitting a multiple gestation claim on the LSHS ICT platform, and I see O30.0 and O30.1, and I submit the two at the same time, it means I don't know the kind of patient that I saw. And we'll see examples later. Also, it will not allow you to submit O30 because multiple gestation is not a specific diagnosis. So we'll see more examples as we go along, but this is what the hierarchy looks like. Every chapter covers a broad section of health conditions. It's further broken down into alphanumeric blocks, which cover subsections, and then those subsections now have decimal points that show the specific diagnosis, and it is actually very specific, as we shall see. So this is just an overview of the chapters contained in the ICD-10. We can take our time later on to see all the different chapters. It covers everything. The ICD-10 is completely comprehensive, from diseases of the musculoskeletal system in chapter 14, to conditions that originate in the perinatal period in chapter 16, to infectious and parasitic diseases in chapter 1, which is important to us in this environment because of the infectious diseases and protozoal diseases that we see, to neoplasms in chapter 2, to even codes for special purposes in chapter 22. We shall see an example of that. So every condition known to man, there's no patient that you have, there's no condition that you're going to see, there's no record that you're going to key in that the diagnosis doesn't already exist in ICD-10, to show you how comprehensive and how useful it is. So it's so important for everybody to understand it and to adapt it to their use of it. So just a quick note on the alphanumeric blocks contained in ICD-10. It's from A00 to Z99, and it flows from chapter to chapter. So for example, chapter 1 contains block A00 to B99, while chapter 2 continues from C00 to D48, and so on and so forth. So this is just to aid your understanding of the hierarchical nature of the ICD-10. In practical terms, like most things that are very technical, over time, you begin to know what these codes are by yourself. So for example, you know that falciparum malaria, for example, that is unspecified is so and so. You will know that multiple gestation, that is a twin pregnancy with complications, is so and so. With use, you will begin to know what the specific diagnoses are. So that is why it's important to understand how the framework of the ICD-10 is. Chapters, alphanumeric blocks, and then decimals that are with the alphanumeric blocks give you the specific diagnosis. So let's give a very common example, malaria. We all see malaria in our various places of work. It's probably the most endemic condition we have currently, despite the pandemic. So how is malaria coded? You have chapter 1, which shows okay, excuse me, sorry. So you have chapter 1, which shows you certain infectious and parasitic diseases. That's what chapter 1 is for. So you expect that malaria, which is a parasitic disease, will be found in chapter 1. Then the alphanumeric block that contains the code for malaria would be between B50 and B64, because B50 and B64 is dedicated to protozoal diseases, excluding amoebasis and other protozoal infections, and other protozoal intestinal infections. So if it's amoebasis and other intestinal infections by protozoa, it won't be in B50 to B64. So it's beginning to narrow it down. By the time you get to B50, B50 is the alphanumeric block that covers Plasmodium falciparum malaria, including mixed infections with any other Plasmodium species. Specific diagnoses then ensue. You have B50.0 as an example, which is for Plasmodium falciparum malaria with cerebral complications. Then you have B50.8, which is other severe and complicated Plasmodium falciparum malaria. You can see that is different to B50.0. Then you have B50.9, which is Plasmodium falciparum malaria unspecified. So just using these random examples, you can see that B50.0 is very different to B50.9. So I shouldn't expect that if I'm on the back end, on the LSHS operations team, and I'm analyzing the data that has been submitted by providers or by a specific provider, if I'm seeing B50.0 and B50.9 at the same time, it shows one of two things. It's either the person doesn't understand how to use the ICD-10, or the person had the very rare occurrence of having a patient that had both, which is very unlikely. So as I've said before, note that the ICD-10 is highly specific. Using this, chapter 1 and the malaria diagnosis generally, you'll find that B50, for example, covers diagnosis related to Plasmodium falciparum. If you take your mind back to the etiology of malaria, it's a protozoal disease, and there are 4 common species of protozoa that cause malaria: Falciparum, ovale, vivax, and malariae. I hope it's not too technical for those that are not clinical. And if it is, then you have to learn it, especially for something like malaria that is so common. So the ICD-10 is so specific that it has B50 that covers Plasmodium falciparum malaria, and then it becomes more specific, point this and point that. B51 covers Plasmodium vivax malaria. B52 covers Plasmodium malariae malaria, and so on and so forth. Then it even allows for B54, which is unspecified malaria, clinically diagnosed malaria without parasitological confirmation. So I'm sure now a few of you begin to understand why maybe your claims were not processed on time, or why they were rejected outright. Because if you submit to me, assuming I'm representing the Lagos State Health Scheme and I'm on the operations team, I'm viewing the data from your hospital, and I see diagnosis like B50.9, Plasmodium falciparum malaria unspecified. And in the same claim, you have submitted B54, unspecified malaria clinically diagnosed. It means you don't know what you're doing, or you haven't taken the time to do the right thing. Because if you're following evidence-based medicine, when you're making a diagnosis, it is either it is clinical or it is a laboratory diagnosis. If it is a laboratory diagnosis where you have confirmed the type of malaria, then of course it will fall under the Plasmodium falciparum malaria. If you've not done a laboratory investigation, but you're certain from your clinical analysis that it is malaria, that is well and good, but you will be using a different code. You wouldn't be using any of the B50s. You'll be using something from the B54 block. So that shows you one of the advantages of the ICD-10 actually. It also helps you with the awareness that even a slight modification in the way you arrive at your diagnosis changes the coding. So if it is clinical, it's different from it if there was a laboratory investigation, because then the coding would be different. And then if you look at the big picture, so you can imagine if we're analyzing the data for Lagos State, we're looking at malaria just as an example. This is just one example. You can then tell if everybody has done their coding right. You can tell to a large degree whether most of it is from clinical findings, whether most of it is from laboratory findings. You can tell whether they had complications and the type of complication. You can tell the type of plasmodium that was involved, or that has generally been involved. So you can see how endemic it is. If there's an outbreak somewhere, which is because what you expect in this environment, just for those that might not know, is Plasmodium falciparum malaria. But if I begin to see codes that are telling me there's Plasmodium malariae, then I know that there's probably a public health problem, or my providers are not coding appropriately. So it's very important that we all key into this understanding that the way you code every single patient feeds into the entire data. It feeds into the data for your hospital, it feeds into the data on the LSHS platform, and it informs the policies that the state government makes regarding the healthcare for you and I, because in the end, we're the end users of healthcare in Lagos State. So let's move on quickly. I just want to quickly mention the special code. So, we talked about how chapter 22 is for special purposes, to show you how detailed the ICD-10 is. So you have U00 to U49, which is for provisional assignment of new diseases of uncertain etiology or emergency use. And you will see where I'm going. So this is to specially mention COVID-19 under the ICD-10 coding. Please note, this is for information purposes only. It's for you to see and to understand how detailed the ICD-10 coding is and how useful it is. So emergency, so if you have you have several alphanumeric blocks of U00 to U49 dedicated to provisional assignments. Then that means that if there's an outbreak of a new disease that has not been coded, then one can use some of the alphanumeric blocks that are still available. So in this case, the emergency use for ICD-10, for ICD codes for the COVID-19 outbreak are as follows. An emergency ICD-10 code of U07.1, COVID-19 virus identified, is assigned to a disease diagnosis of COVID-19 that's confirmed by laboratory testing. While U07.2, COVID-19 virus not identified, is assigned to a clinical or epidemiological diagnosis. So this should take you back to the malaria example I just used. If you've done the test and the person has the virus, then you use one code. If you've not done the test, but clinically and epidemiologically, there's a pandemic, you expect that the person that has all these conditions has COVID-19, then you use a different code. And then either code can be used as mortality for cause of death. So this information is actually available on the WHO website. So what this means is that in the case of a pandemic, as we've had this year, immediately the WHO assigned U07.1 and U07.2 to COVID-19. So in the case where you are actually, if you are coding for COVID-19, there's already provision made for it. To show you how detailed it is. So this is for information purposes only. Please remember that the management of COVID-19 patient remains as stipulated by the appropriate authorities. This is not for you to go and say that Lagos State did a training on COVID-19, not at all. This is to highlight the importance of the ICD-10 and to show you how impactful it actually is. Because what this means is that even though COVID-19 is a new disease that nobody had known about before, by this time next year, for example, the WHO, before then obviously, but what I'm trying to say is that they can then collect the data from different regions of the world and make different comparisons, all sorts of postulations, because everybody would have used the same code, and it would have been whether the virus is identified or not identified, very specific, very useful, very important to inform healthcare policy, financial allocations, and so on and so forth. So in view of how because the LSHS team was kind enough to provide some of these examples. These are some of the things that they have seen from some of the people that's actually on this call. So if you see something that you submitted before in the past, you may not have understood why, but now you will. Or by now you should even have, because of the discussion we've had up until now. So example 1, incisional hernia with obstruction without gangrene. Incisional hernia without obstruction or gangrene. That was submitted for one patient in one claim. So even without being a doctor, if you're not a doctor, if you're a medical records manager and you're good at your job, you know what you're doing, you should be able to decode that. It's not likely that one person will have incisional hernia with obstruction and then also have incisional hernia without obstruction. There's a difference there. There's a clear difference. It looks strange. So it's incorrect because you have to choose one diagnosis. They are very different. They may not seem much different, just a difference in one or two words, but it's a whole, it's so different in terms of the clinical presentation, the management, the treatments, the financial allocation for that specific condition. Very different. Another example of what we've seen is secondary hypertension unspecified, essential primary hypertension. This is basic medicine here. The nurses and the doctors on this call would see immediately that secondary hypertension, essential primary hypertension, you can't see it in the same patient. It's actually not possible, you know. It's either or. It's either the person has essential or the person has secondary. One person cannot have both. So this is another example of number 3 that we have kind of mentioned, using malaria as an example. So we had a claim submitted saying that the code was Plasmodium malariae malaria with nephropathy and Plasmodium falciparum malaria unspecified. My dears, it's not likely. The laboratory professionals amongst us are the ones that would even call this out, especially. It's not likely that you will have one patient, the same patient, with malaria, with nephropathy for that matter, and then with falciparum malaria. So you have to be specific. We already saw that there are several blocks that have been assigned to malaria alone, with a separate block for each type of malaria. So please use the specific coding for malaria, very important. Then this one is a little bit funny actually. Number 4, pregnancy-related conditions unspecified, second trimester. Encounter for supervision of normal first pregnancy, first trimester. 32 weeks gestation of pregnancy. So what this means is that the same patient that was seen at the same time, at that point in time, was in first trimester, was in second trimester, and was in third trimester at the same time. So except it's a sci-fi movie, that's definitely not possible. So the pregnancy is either first trimester or second trimester or third trimester. It can't be all 3 at the same time. So it goes on and on. So this was just to highlight some of the submissions that we have seen. And it may be a little bit funny, but it actually isn't very funny when you think of the repercussions. On your end, it would mean that you may be a bit confused as to why your claims have been rejected. This is why. On the side of the LSHS is a bit, it can be a bit discouraging, and it makes managing the scheme a bit more difficult because you're not getting the specific diagnosis. And so you're not able to make the appropriate decisions for different types of healthcare needs within Lagos State. So these things are very important. We need to submit correct diagnosis. About the technical aspects, and it can sound, oh my God, we're talking about chapters, alphanumeric blocks, and so on and so forth. It is actually very easy to use, the way the LSHS has designed it for you to use on the ICT platform, and we'll see why. So I think we'll take a pause here. If the LSHS team is okay with that, maybe a 5-minute break, and we'll allow some of the questions to come in and answer them. I think it would be good if you can type in the questions so that we don't have everybody talking at the same time. And then we'll take questions that apply to everything we've said up until now. We'll just take a few of them. So please type in your questions, any questions you might have for everything we've discussed up until now. I can't see anybody typing. Is it that we don't have any questions? Okay, great. Okay, I've started seeing your questions. From Daniel Olariwaju. How do we input for antenatal registration second trimester? I hope you're not the one that saw a patient with all 3 trimesters at the same time. Hope we'll get copies of this training for us to download or print out. Can we have some copy of this lecture in our mail? Okay. Okay, so to Daniel and to everyone, how you input for antenatal registration. So remember we said earlier that there's a whole chapter dedicated to pregnancy and the puerperium. So what you will need to do, it's part of, but it keys into the second questions around getting copies of this training. I think the LSHS team is best to answer that on how you get the copies of this training. And in addition to that, at the end of this training, I'll also provide all the resources. Everything is on the WHO website. There's a self-learning tool. The ICD-10 online portal is there. If we have time, I can show it to you. So you can actually use the ICD-10 portal live by yourself from the WHO website. So I'll show you that. How do you take records? So let me go back quickly. Daniel Olariwaju, antenatal registration, you go to the applicable chapter. If there's anything specific about the registration per se, I think the LHS team can respond to that in terms of registration. But basically, you just use the appropriate diagnosis for the second trimester and key it in. Copies of the training, we've spoken about that. So I'll give you resources at the end. And also the LSHS team will provide materials after this, and they will let you know how you will get it. How do you take records from the platform for patients you have seen on previous dates? I think the LSHS team will respond to that. Dr. Serrano, Dr. Ife, please you respond to that. Thank you for the presentation we're having. Okay, yes. Antenatal registration, okay, that's recurrent. Okay, so we'll note those 2 recurrent, getting the training presentation and how to get the correct diagnosis for antenatal registration. I think that may be specific to the LSHS and more than just the ICD-10. So we'll find out from the LSHS team how you can do that. Okay, I think we'll stop taking questions for now. We have another, we'll have another Q&A session once we are done. Well, please know that your questions have been noted, like the person asking about referral codes. LSHS team, please note some of these questions that refer to operations. Are we going to be giving computers? LSHS team, again, will respond to that. Call center number not going through. What does that have to do with ICD-10? Okay, so let me move on. Continue to type or at least to note your questions and then type them into the chat box. And at the end of the presentation, we'll take everything so that where there are multiple questions that are similar, we'll respond to all of them at once. Thank you, Ibijola. Okay, so the next few slides are also a bit more technical, but we've touched on a lot of it already. So the importance of the ICD-10, including claims processing, very important. It's all about the money, isn't it? So we mentioned some of this in a different way, but just to highlight that the ICD-10 allows the processing of claims for value-based reimbursement and improving reimbursement systems. So if I am your health management organization, whether it's Lagos State or any other, you could find yourself anywhere in the world, and they're submitting multiple diagnoses with some of the examples that we've given, there is no way I'm going to reimburse you, because I'm only going to reimburse you for quality care that has been provided. If you've submitted a diagnosis of first, second, and third trimester, I'm not going to reimburse you because it just doesn't make any sense. So the ICD-10 allows the standardization of diagnosis and the coding of that, which then feeds into the reimbursement process. It also feeds into the outcome measurements. So if I'm specific, if we're looking at antenatal, for example, by the time all the providers, because I know you guys are great, the feedback is so good already. I know that the coding I'm going to get for pregnancy and the puerperium will align. So imagine everything is aligning. I can look at the data for third trimester pregnancies, for example. Then I can look at the ones specifically that had complications. Then I can then look at the mortality rates. So it would help measure the outcome, basically. So, and it can be specific, it can be general. I would then see that generally speaking, for example, the mortality rates are, let's say, 20%. But if I look at a certain region or at certain providers, I see that their own outcome and the mortality rates for third trimester complications is, let's say, 50%, 60% more than the average. Then I can begin to interrogate that particular aspect to see what the issues are, to bolster. See, it's about why. It's about why is something wrong in the first place. So if I'm seeing that the outcomes are unexpected or are worse than in other areas, then we can begin to support that particular region, that local government, for example, that community health center, for example. Why are the maternal cases ending in 50% mortality? Then we can support, provide resources, beef up the staffing in that area, for example, provide training, help them with their supply chain logistics and things like that. So that's how the policymakers are thinking. So it helps in measuring outcomes. It helps with performance management from the clinical aspect, financial aspects, administrative aspects. So if the medical record managers, of which I think there are many on this call, it begins to show us how well qualified you are, how versatile you are, how conversant you are with the ICD-10, right? Because if I'm seeing, if the quality across the board is not as high as it should be, then I will know that those personnel, for example, may need more training or may need a certain level of qualification before being employed in the first place. Those are just some examples. Then from the clinical aspect, we begin to know whether our medical practitioners are actually practicing evidence-based medicine, for example, or if there's a disconnect between the clinical professionals and the administrative. So if the doctors are actually practicing evidence-based medicine, they are keen in the appropriate diagnosis. But the administrative staff, for example, are not keen in using the appropriate ICD-10 coding, then we would have to close that sort of gap. So those are the things that the ICD-10 helps with. And as we've said before, it helps the design of payment systems and claims processing. So we've seen that the LSHS ICT platform has coded the ICD-10 on the back end. So predictive text on the front end makes it easy for you to key in your diagnosis and so on and so forth. So it also helps with the disease process management. It helps improve disease management for some of the reasons I've mentioned earlier. And then when it comes to claims, it allows for fewer rejected claims. So take your mind back to some of the examples that we gave. That means what we expect after this sort of training is that you'll be submitting your claims with correct diagnosis. There'll be fewer disparities because you have a better understanding. You know that it is very likely that if you see Mrs. Lagbaja and this is the condition she has, that specific condition is there. You don't have to use some other method. You don't have to put 3 or 4 because the specific one that she has is likely to be there. Then it also means that there'll be fewer fraudulent claims, because the thing about fraudulent claims is that it shows that it's either there's a complete lack of understanding or the person is trying to get reimbursements where they don't, they shouldn't get it. Whatever the case, the way the coding is submitted would show for that. So it improves the quality across the scheme. And that's what we expect to see after this training. So some of the practical tools that I've mentioned earlier, but just to recap, use the predictive text on the ICD platform to your advantage. You don't have to know everything at once. Don't feel overwhelmed by this information that you're getting, especially for those who may not have known much about the ICD-10 at first. Like anything that we all learn, we've all had different levels of education. It's always, first we started by 1 + 1 in primary school or nursery school, and then we moved to multiplication. So with use, you understand it. So the fact that there's predictive text on the ICT platform, it will allow you, you know that by the time you type in primary hypertension, you will have fewer options than if it's just hypertension. So it will be easier for you to submit the code. That's just one example. When you do so, please scroll down to make sure you see all the available options. So what you can see, has talked about how technical and hierarchical the ICD-10 is. We talk about the chapters, the alphanumeric blocks. How many of you notice that in practical use is not so important, because the LSHS has already designed the ICD platform to be very easy to use. I don't need to know that B50.1 is falciparum malaria with complication. All I need to know is that this patient has falciparum malaria, and I type it in. And then the options of falciparum malaria will come up, and I choose the appropriate one. So these are some of the practical ways that will make it very easy for us to begin to implement this quickly. So as I've said before, familiarize yourself with them. I'll give you the resources. The WHO website alone has everything you need. And it also has the ICD-10 online portal. So after this presentation and after today, going forward, you can go there. You can have it open on your laptop every day if you want, on your computer, just to familiarize yourself with it. Then use the abridged ICD-10 that the scheme has already provided to you. I think that one, it's abridged, so it's shorter. You can print out a hard copy if you want. We can confirm the LSHS team if you need more copies or what have you. But basically, it contains, as we always say in medicine, common diseases occur commonly. So we start with the endemic things, the pregnancy that we're talking about, hypertension, malaria, diabetes, cancers, everything is there. So the more you use it, the easier it will be. And then if it's not there, then you can go online to be more specific and to be certain. You can also take the free online training available on the WHO website. I will share that resource. Remember your evidence-based medicine. Remember we said everything is evidence-based. Evidence-based medicine, evidence-based reporting, evidence-based claim submission, everything is evidence-based. If this condition exists, it will be classified in the ICD-10. We've already seen how robust it is. So it helps you with remembering and being aware of more specific conditions like other protozoal diseases, for example. It helps you being aware of the different types of hypertension. It keeps you fresh as a healthcare professional, so that it improves the quality of care that you're providing to your, and it also improves your value to the entire ecosystem, the healthcare ecosystem in Lagos State. If you know what you're doing, if your medical records managers know exactly what they're doing, they know the ICD-10 codes to use, your administrative staff, they know how to key it in, your front desk, your GPs, your consultants, your MDs, everybody's on the same page in the ICD-10. The quality of care in this place will go up tremendously, both in terms of what you're providing to the patients, because the treatment protocols for each specific condition is the same. In terms of the reimbursement, the value of reimbursement you'll be getting from the LSHS, because then we don't have to worry that the data is skewed or that the data is incorrect. We know that what we see is what actually exists. Then it informs policy making. It feeds into the bigger picture. We can see what the healthcare indices are for the indigents of Lagos State, for the users of the health scheme. So these are some of the practical ways that you can submit your claims using the ICD-10. So this is just a screen grab of the abridged LSHS ICD-10 coding that was provided to us. If we have any questions around that, then we can type it in and we'll take it in the next Q&A session, which is actually now. So please type in your questions again. Whether if they were not answered before, please. Me responding to some of these questions, especially questions such as antenatal registration, how do they code for that, and in terms of getting the resources for this presentation. So please type in your questions and then we can proceed shortly. Okay, questions are coming in. Questions are coming in. Sorry to Titi Okusaga, I hope you can hear me now.
Yes.
Aha. I'm seeing some very interesting questions. Okay, so I'll go through the questions and I'll answer specifically the ones that apply to this training. And then I'll allow the LSHS team to respond to the others that are more operational. These are the training. So how do you take records from the platform for patients that you've seen previously? I'll allow the LSHS team to respond. How you will get the copy of this presentation, the LSHS team to respond to that. Referral code for patient that does not receive text message, the same thing, LSHS team will respond to that. Folusho Ishola. Are the healthcare providers, both medical doctors, medical record, will be given computers? Who will be responsible for it and the data needed for this to work? I don't think I'm going to give anybody any computers, so that the LSHS team too will respond to that.
Okay, sorry. Hello.
Yes, Dr. Serrano.
Okay, yes. So what will happen is I'll answer some of the questions. The questions that pertain to ICD-10, Dr. Martins will answer it, and questions that pertain to the LSHS, I will answer it. So to the question, who will provide computers? So what happens is that every facility within the LSHS scheme is paid capitation and fee for service. So the revenue that it gets from capitation, you can invest part of it to purchase your laptops and to pay for data for your internet. If nobody is using the data to watch YouTube or African Magic, I think 1 gig data is more than enough to last a month. And for the resources of this presentation, what happened is that the video will be made available on our YouTube channel. So hopefully by today or tomorrow, we'll send everybody the link of the video for this training and the last training event.
Okay, great. Thank you, Dr. Serrano. Then somebody asked about call center numbers not going through. How do we go about it? I don't know how that applies.
You can send that directly to us. Yes. So we'll address LSHS issues that pertain to ICD-10.
Okay, great. So somebody says diagnosis for uterine evacuation procedure. The items that were available, you couldn't choose because you couldn't find it. We'll check that. I think we have a little bit of time. So I will take you to the ICD-10 platform online, and then we'll see where uterine evacuation would fall. Is there any test that the LSHS client does not cover? I'm not sure that's related to ICD-10, Dr. Serrano.
Well, to that, you can read our benefit package that has a comprehensive list of what is covered.
Great. How fast to get authorization code? This is not related to ICD-10. Please, your question should be related to this training. How do we get codes for investigation? Informative display, thank you. Who is really responsible for the coding? Taiwo Abiodun Wellington. I find this question. What does this mean? What do you mean by who is really responsible for the coding? Are you talking about who is responsible in the hospital for submitting the coding? If that's the case, and it's only your provider hospital that can, because every hospital has designated somebody to carry out this task. So this gives us your name. We don't have an idea of what your profession is. Some hospitals is the front desk officers that are in charge. Some hospitals have designated EMR managers, medical records managers. So whatever your hospital administration has decided is responsible, that's the person that's responsible. And my presumption is that if you're here on this training, then it's likely that you are the one that's responsible because you're representing your hospital. Technopop 4, if a doctor diagnosed 3 diagnoses on a patient card, which one will we take first? You see, this is part of what we said earlier. It will then force everybody, if you're actually implementing the ICD-10, it forces everybody to align to quality control. So what happens for some of the doctors is you may have a diagnosis, you have one diagnosis that's more likely than the others. Sometimes it's differential diagnosis, meaning that it could be one of the many. Sometimes the person may have several medical conditions. So you would then have to confirm with the doctor that saw the patient. The person had 3 diagnoses. It's only the doctor that can tell you which diagnosis is confirmed, which is certain, and that's the one that you key in.
Okay, so let me just add a little bit to that. So with respect to if a doctor has 3 diagnoses, if a patient has 3 diagnoses, case in point, hypertension, diabetes, and arthritis, our ICT platform allows you to put as many diagnoses as required. So we just can put all the diagnoses as 3 separate lines, or if it's 10 diagnoses, as 10 separate lines with respect to diagnosis. So as long as they are proper diagnoses, you can put as many as possible.
Yes. Thank you for that, Dr. Serrano. So what that means, I think the person's question, maybe I think the person was worried because I said some people submitted, for example, the pregnant woman that was in 3 trimesters at the same time. So if your doctor puts 3 diagnoses, but each diagnosis is different and it makes sense and is evidence-based, then as Dr. Serrano just said, you will be allowed to submit it on the platform and it will be processed accordingly. But what I would then say is that you should confirm from the doctor just to make sure that you're all on the same page. What happens if diagnosis is not captured in ICD-10? Musa Odine, maybe you missed the part where we gave the example of COVID-19, a disease that didn't exist until earlier this year, and yet it has a code. So basically, every diagnosis and condition known to man that is evidence-based has already been coded, already has a code. And in the case of COVID-19, which we gave as an example, clearly because of a new disease, it didn't have a code, but there was already a so it just shows that you need to update. So it's not just the doctors or the nurses or whoever it is that goes for training and that, you know, keeps abreast of recent happenings.
you also have to keep abreast of recent happenings, know what is happening in the medical ecosystem and worldwide. All the diagnoses are captured. Will representation of rejected claims be entertained, Dr. Serrano?
Yes. Okay. So what happens is that when a claim is rejected, there's always a basis for rejection. So once you correct that basis for rejection, it will be accepted. So LASHMA's aim is to ensure that all providers are paid for proper service. So if you present a bill the proper way, it will always be paid. But if you keep repeating the same mistakes, after a couple of cycles, the system will reject it.
Okay, thank you. How do we input UTI and confirmed UTI after laboratory investigation? Can both diagnoses appear on the claim? I think that question has been answered, just a different, as Dr. Serrano said, the ICT platform allows for submission of different diagnoses. So the idea is that as long as it is evidence-based and you're certain of what you're submitting, the platform will allow you to submit both diagnoses on the claim. How do you code for multiple morbidities? The same response to Safia. I hope you are listening. What is the best ICD-10 code for hypertensive urgency? My question to you will be, what is hypertensive urgency? Is that a diagnosis? What does it mean? I personally haven't heard of it before. So you would need to be more specific. I believe ICD-10 also incorporated diagnostic and statistical manual of mental disorders. Yes, the DSM is more or less. So there's a chapter in the ICD-10 that allows for mental disorders. So the DSM is I won't use the word obsolete, but it's separate. So it is contained in ICD-10. Hypertensive urgency has come up again. I don't know if it's the same person. I don't know what hypertensive urgency is. It's not a diagnosis I'm familiar with. Dr. Serrano, have you heard of it before?
Okay, so with respect to hypertensive urgency, the person needs to clarify. Is this person is hypertensive heart disease, hypertensive crisis, hypertensive encephalopathy? So which kind of?
So I've never heard of hypertensive urgency. That's not a diagnosis. You have to be specific. So are you talking about a hypertensive emergency? And if so, Dr. Serrano has given some of the examples that would fall under a hypertensive emergency. And that in itself can be varied. It can be varied. So you need a more specific diagnosis. This is not a diagnosis that is evidence-based, unfortunately. Is ICD-10 code for first trimester pregnancy different from second trimester? Yes. I've downloaded ICD-10 PDF format. I want to know if the PDF format is valid for use. Of course it's valid for use. It depends on, as long as you got it from the WHO website, which is the only source that I can confirm is valid, then definitely it is valid for personal use. And what that means is that you can then refer to it at any point in time. And then when you're typing on the ICT platform, you use the appropriate code that is there. But make sure the code that you're typing in is suggested to you from the predictive text on the ICT platform. And then you can key it in. Dr. Odoji, thank you. Dr. Serrano, you have some comments here about 1 gig. And some other non-ICD-10 related questions. Crystal, I think we've responded to your questions on UTI. So yes, you can have multiple diagnoses. Make sure that they're not contradictory, like the examples that we gave, and is evidence-based.
Additionally, there is hypertensive urgency. Okay, then please just clarify what you mean by hypertensive urgency. Give an example, please, and then we can take that further. Severe hypertension with acute damage to the target organs. Okay, so maybe we shall carry some analysis and check it with ICD. We also notice some diagnoses are not found on the portal that affects bill processing on the portal. Well, as I said, the ICD-10 in its totality has been keyed into the ICT platform. So if you say diagnosis,
no.
Sorry?
Yeah. Okay, so what happens is on the IC platform, the entire ICD-10 is captured on it. So all 70,000 plus are on the ICT platform. If I'm right with the question concerning UTI and suspected UTI, so if a diagnosis is, let's say, UTI, the person goes to the lab, does urine MCS, and they come back that it's a UTI secondary to Staphylococcus aureus. This is just a case. So you can, on the ICT platform, select the UTI secondary to Staph aureus and delete the suspected UTI unspecified. So you can always upgrade your diagnosis on the platform. From example, malaria unspecified. When person does an MP, you remove malaria unspecified and replace that with Plasmodium falciparum malaria. Okay, thank you.
Yeah, great. Thank you, Dr. Serrano. So just to quickly end this session, so these are the must-knows. We've already talked a lot about this. And this reflects in some of the questions. The ICD-10 is detailed and contains all diagnoses that are currently available, everything. Everything is already there. We'll check out the hypertensive urgency you're talking about, Adeshola, and see what comes up. Then following best practice, your diagnosis submission must be evidence-based. You've discussed that, very important. Submission on the LSHS ICT platform must be keyed in using the appropriate code, please, very important. The predictive text makes it easy. We can't iterate that enough. And submitted diagnosis must not conflict. So Crystal Hospital was asking about the UTI. As Dr. Serrano said, you can upgrade. So what that means is that you become more specific in your diagnosis. So you're upgrading and updating the information to the more recent and the most recent evidence-based evidence that you have, which is fine. Notice that in the examples that we gave earlier, the diagnoses were conflicting. So that's automatically, you know that there's a problem there. So diagnosis must not conflict. So your accurate diagnosis using ICD-10 code submission is a prerequisite for claims processing and subsequent payment on the LSHS platform. So I believe that we've answered groups of questions that apply to you for this ICD training. If we have a little bit of extra time, I'm going to stop sharing my screen, but if we have a little bit of extra time, then we will check out the hypertensive urgency that Adeshola was talking about and use that as an example of what happens if you can't find or you don't think the diagnosis exists on the ICD-10 platform. So thank you very much. Over to you, Dr. Serrano.
Okay, so thank you very much. So what happens that some of your questions and queries with respect to the ICT, so from where the LSHS is, not all the, if your diagnosis is wrong, you're not likely to get paid. You're not likely to get paid. Yes, you're not likely to get paid if your diagnosis is wrong. Now, unfortunately, I was out of your meetings briefly. So with respect to antenatal care and capturing of the diagnosis, so now what happens is that the ICD-10 makes provision, and which we want to have. You have an option of one, specifying your diagnosis based on the exact week of gestation. So you could have 23 weeks gestation for supervision of pregnancy, or you can have supervision of antenatal care, first trimester, second trimester, third trimester. So these things must tally with the request. So you cannot make a request of supervision of and supervision of pregnancy first trimester, and then select ANC2 as an option, it will be rejected. We are trying to collect data. We've observed of recent that more than half the requests that are made actually are rejected on the basis of choice of diagnosis. And this is affecting the quality of data that we get. But it's important, as I said earlier, it's important that we sort that out and ensure the right data is captured so all your bills can be paid on time. Yeah, cool. Sorry, now for diagnosis for uterine evacuation. So now there are different reasons for uterine evacuation. So in terms of the procedure, there's evacuation as per procedure for billing LASHMA. However, for the diagnosis, there are multiple diagnoses. It could be incomplete abortion or different reasons that could lead to the diagnosis is different from the billing procedure. The diagnosis you will find on ICD-10, the billing procedure you will find on the diagnosis you find on ICD-10, the billing procedure you find on treatments. You find on treatments. Now, for admissions, if you want to bill for admissions, you of course you have to put the right diagnosis in this issue. You have to put the right diagnosis. And when you're billing for admission, you also need to specify the day of admission and the day of discharge. So, Dr. Martins, any more questions to answer? Monitor.
Great. Thank you for. Okay, am I back? Can you hear me now? Serena, I think you answered the questions that were directed to you, and I think I'm done with mine, except if there's any that I missed out. Otherwise, I think I'm done, and I'm thankful and grateful. And I hope we all learned something. I know I did, definitely. So thank you for your time.
Thank you very much, Dr. Arno Martins. That was a very rich presentation, and I know that we've all learned something today. As Dr. Serrano had said, everybody will get a copy of today's presentation via the YouTube channel, and the appropriate link will definitely be sent to everyone. So thank you so much once again, Dr. Arno. We appreciate you. And thank you everyone for taking out time out of your busy schedule to attend today's training.